recent research has identified that the type of oil we eat has what is called polyunsaturated fatty acids. And these polyunsaturated fatty acids, the long-chain polyunsaturated fatty acids, when you eat them, and there are plenty in your body, they get elongated to become very long polyunsaturated fatty acids. And they are easily oxidized to become prostaglandins. When they are oxidized, they generate what is known as free radicals. These free radicals have been identified by the medical profession as the cause of many diseases. Some of the diseases are menstrual pains, headaches, cancer, diabetes, autism, and so many others. Well, because of this, they often recommend antioxidants. However, the question is, why eat oils that produce free radicals and then go and take drugs which are antioxidants to stop the oxidation? Further, when the pains do come, then analgesics are recommended. In view of this, quite a number of prominent, reliable, well-educated scientists and medical officers are saying that the fat that the Americans and WHO are recommending should be taken out of the diet. And if you do that and start eating the type of fat our ancestors were eating, that is tropical saturated fat, organic butter, organic animal fat, and olive oil, these antioxidants will not be produced in the body for the need to use these prostaglandins will not be produced in the body for us to take antioxidants and analgesics. The simple solution then is we stop taking those oils and take the saturated fats, which our ancestors treasured. The other factor is that if you want to eat grains, you should ferment them well. You should not eat whole grains. And these are the issues. Currently, the country imports more than $100 million of these bad oils. And then we import lots and lots of medicines and antioxidants to help us cure the resultant diseases. So the country loses double.
So has there been any any suggestions or concerns raised about it by the intellectuals and you or like-minded persons to get this addressed?
Well, there's so much literature about this. The internet is full of it. There is an international organization which has been protesting. In this country, I've written a letter to the Ministry of Health telling them that if they do not reverse their policy on non-communicable diseases, then the diseases will keep on increasing. Now the rate of increases of diabetes, hypertension, autism, menstrual pains, candidiasis, labor problems, children born with diabetes, children born with upgaze, Down syndrome, and even women are afraid to become pregnant. There is even the problem of women unable to enjoy sex and men finding it difficult to rise. The problems are too many. Headaches, for example, is very common. So it is important that the Ministry of Health looks at the problem and sees to it that the current trend or the high rate of diseases is reversed, especially the non-communicable diseases. You see, the FDA tends to be in a very strange position. it was recommended by the American government to the Ghana government to set it up. So they tend to believe what the Americans are saying. As we are talking, by the 1950s, there were only about 3 or 4 autistic children in America. Now there are about 3 million because of the type of oil which by law they should eat. That is unsaturated vegetable oils and fish oils. A law was made in 1988 by the American government banning, in effect, tropical saturated oils. And so it is difficult for people to send officially oils to America. The food chain in America doesn't do that. And it's the American government that recommended the setting up of FDA. And they take instructions from the US FDA, that's the Food and Drug Administration of America. Well, according to them, one of our governments, I think some years ago, asked the FDA to examine the issue because it's been recommended by the WHO that trans fatty acids are bad for us and it should be eliminated. Trans fatty acids are polyunsaturated fatty acids. So in effect, polyunsaturated fatty acids should be eliminated from the food. That is, the vegetable oils, soybean oil, sunflower oil, corn oil, palmolene, and a few others. Canola especially is known to be poison because it comes from rapeseed. You can look it up on the internet about rapeseed. But unfortunately, the Food and Drugs Authority claims that these trans fatty acids don't exist in the food in Ghana, and that if the government wants them to do anything about it, then special money should be voted for them to do a survey. And we know we have financial problems in this country. And these studies have already been done by other countries, so there's no need to go back. Denmark, for example, has banned these oils. And in view of that, within 5 years, the heart diseases dropped by more than 50%. In our case, it's rising very fast. The current rate of these non-communicable diseases is known to be more than 10% per year. And if it's 10% per year, and the population growth is about 3%, then very soon we should all be sick. And actually, lots and lots of people have hypertension. Diabetes has become very common. Autism is increasing very fast. Most young girls have serious menstrual pain problems. They have candida. A lot of young men are finding it difficult to satisfy their partners.
So what would you say? What should be done concretely? Should we ban these products?
Well, I would suggest so. I mean, a number of countries have made laws to that effect. Even simple administrative instructions or executive decision can change the situation. And the laws have been proposed by the WHO. The benefits are many for us because we will be able to promote our local oils, and in which case work will be available because as the local oils are promoted, a lot more factories will produce them, and they will need hands. The farms will get jobs. No, there will be jobs in the farms. And so the farmers will be all right. So wealth will flow around.
Others do argue that local oils, especially the palm oil, is highly concentrated with cholesterol. Is it true?
Well, I think that is the biggest scientific lie. Cholesterol is only in animal fat. There's no cholesterol in vegetable fat. And palm oil is vegetable. And there has never been any cholesterol. And the real scientific truth, the heart disease is caused by what is known as atheroma plaque. And the atheroma plaque contains only polyunsaturated fatty acids. You can look it up in any meaningful biochemistry literature or scientific literature on atheroma plaque. You can ask any pathologist. The plaque which causes heart diseases is from polyunsaturated fatty acids. And palm oil, coconut oil, palm kernel oil, cocoa butter, and shea butter do not contain cholesterol. And when you eat them, You increase the good cholesterol and you reduce the bad cholesterol. That is the LDL. It is when you eat the unsaturated vegetable oils that you increase the bad cholesterol and you reduce the good cholesterol. The bad cholesterol, you don't see it when you do the measurement in the blood. When the question of cholesterol and saturated fat came about, there were no good analytical equipment to distinguish between the low density lipoprotein cholesterol and the high density lipoprotein cholesterol. Now, these things have been clearly measured, and it is known that the LDL, the low density lipoprotein cholesterol, contains polyunsaturated fatty acids. And when you eat the unsaturated vegetable oils, they increase them. And these are the things that cause heart diseases, diabetes, hypertension, prostrate. But then the other one, when you eat it, it relieves you of all these diseases. There is evidence all over the world. If you look at the current literature on the internet about how to cure ailments, they will tell you eat coconut oil or palm kernel oil. And actually, for more than 40 years, doctors around the world have been using palm kernel oil and coconut oil for intravenous infusions for premature babies. It is there. You can go to the literature.